In many societies around the world, a woman's perceived virginity carries immense weight. It is often seen as a marker of purity, moral worth, family honor, and eligibility for marriage. Families may celebrate or demand proof of bleeding on the wedding night as evidence of an intact hymen, while communities in parts of Africa, the Middle East, Asia, and beyond continue practices like virginity testing, also known as two-finger or hymen examinations, to verify sexual history before marriage, employment, or even as parts of legal proceedings in cases of alleged moral crimes. In some cases, failing such a test can lead to several consequences: social rejection, family violence, forced marriage, or even so-called honor killings. These expectations are deeply rooted in cultural, religious, and patriarchal norms that link female chastity to family and community reputation. In Christian and Muslim traditions, teachings on premarital abstinence often reinforce the idea that virginity symbolizes spiritual cleanliness and obedience. Yet, this intense focus on virginity has real human costs. Girls and women face restrictions on everyday activities such as running, jumping, sports, or using tampons out of fear that this could damage the hymen and compromise their perceived purity. The resulting stigma creates a harmful virgin-whore dichotomy. Sexually active women, or those believed to be, are labeled as defiled, ruined, or dangerous, leading to slut-shaming, ostracization, diminished marriage prospects, justification for sexual violence, and in extreme instances, honor-based killings. Despite these widespread beliefs, modern medical science tells a different story. Virginity is not a verifiable physical state. The hymen, a thin elastic membrane at the vaginal opening, varies greatly from person to person and changes naturally over time due to non-sexual cases like puberty, exercise, or tampon use. There is no reliable way to determine whether someone has had penetrative sex by examining the hymen, and the practice of virginity testing has been condemned by major health organizations, including the World Health Organization, as medically baseless, painful, humiliating, and a violation of human rights. This documentary explores these realities step by step. First, the anatomy and natural variations of the hymen, then how cultural and religious beliefs link it to virginity, and the social harms that follow. And finally, the peer-reviewed scientific evidences that debunks long-standing myths. By separating facts from tradition, we can challenge harmful practices and promote a healthier understanding of bodies, consent, and human value. The hymen. The hymen is a thin, elastic membrane of mucosal tissue that partially surrounds or covers the opening of the vagina. It forms during fetal development from leftover embryonic tissue and has no known biological function after birth. It's not a barrier, seal, or proof of anything. Contrary to popular belief, the hymen is not uniform across all people. It comes in a wide range of natural variations. Common shapes include annular, ring-like encircling the opening, crescentic, moon-shaped like, covering only the lower part, fimbriated, fringed, edge-like, septate with a band dividing it, or even microperforate, very small opening. In some individuals, the hymen is naturally minimal or absent entirely from birth, a perfectly normal variation that requires no medical intervention. The hymen is highly elastic, especially after puberty, when hormonal changes make vaginal tissues more flexible and stretchy. During puberty, estrogen increases the hymen's thickness, collagen content, and overall elasticity, allowing it to accommodate changes without damage. Over time, everyday activities can gradually alter its appearance. Riding a bicycle, gymnastics, horseback riding, dancing, or other sports involving straddling or impact, inserting tampons or menstrual cups, or even self-exploration like masturbation or fingering can cause the tissue to stretch, thin, or develop small notches or openings. These changes happen naturally and painlessly in most cases, often without the person noticing. Many long-standing myths surrounding the hymen. The most common being that it acts like a seal that dramatically breaks or tears during first penetrative intercourse, always causing bleeding and pain. This idea is simply not supported by medical evidence. Bleeding occurs in only a minority of cases. Studies show it happens in roughly 37 to 43% of first-time penetrative experiences. And even then, it's usually minimal spotting rather than heavy bleeding. Pain, when it occurs, is more often due to lack of arousal, tension, dryness, anxiety, or inadequate lubrication than any specific breaking of the hymen. In reality, the hymen typically stretches rather than tears during penetrative sex. Because of its elasticity, especially in post-pubertal individuals, it can expand to allow penetration with little or no visible injury. First-time penetrative sex causes no consistent or detectable or permanent biological changes to the body. Nothing disappears or is lost anatomically. The tissue may develop small irregularities or become more open over time, but these variations are normal and cannot reliably indicate sexual history. Medical experts emphasize that the hymen's appearance alone tells us nothing definitive about whether someone has had penetrative sex, because its appearance varies naturally between individuals and over time. Understanding the hymen this way helps separate fact from fiction. It's just a small piece of flexible tissue, not a marker of purity, experience, or worth. By debunking these myths early on, we can reduce unnecessary anxiety and challenge harmful assumptions tied to it. Hymen and Virginity. While the hymen is simply a small elastic piece of tissue with no fixed role in determining sexual experience, many cultures and religions have long treated it as a symbol of virginity, purity, and moral worth. This section explores why virginity carries such heavy significance in certain communities and why attempts to prove it through physical examinations are not supported by science. Why is virginity a big deal? In many Christian and Muslim communities, as well as in various traditional societies across Africa, the Middle East, South Asia, and beyond, virginity before marriage is viewed as religious and cultural ideal. Teachings in the Bible, example, passages emphasizing chastity and purity, and in Islamic texts, example, emphasis on guarding one's chastity until marriage, often frame premarital sexual abstinence as a sign of moral integrity, obedience to God, and personal honor. For families and communities, a woman's virginity is frequently tied to family's reputation, social standing, and the honor of the household. This belief creates intense pressure on girls and young women. In some conservative settings, families actively restrict girls' physical activities such as running, jumping, gymnastics, horseback riding, bicycle, or even certain dances to protect the hymen from stretching or tearing before marriage. The fear is that any change to the hymen could be misinterpreted as evidence of prior sexual activity, damaging marriage prospects or bringing shame to the family. The consequences of this emphasis go far beyond restrictions on play or sports. It often reinforces a rigid virgin-whore dichotomy. Women who are or are believed to be sexually active outside marriage are labeled as defiled, ruined, impure, or dangerous. This leads to widespread practices such as slut-shaming and public humiliation, social ostracization from family or community, reduced marriageability. In some cultures, non-virgins are considered unmarriageable or offered lower dowry bride price. Justifications for sexual violence, example, the harmful myth that only pure women deserve protection. In extreme cases, honor killings where family members kill a woman or sometimes a man perceived to have brought shame through sexual behavior, real or rumored. These outcomes show how the cultural elevation of virginity can turn into a tool of control, punishment, and violence, particularly against women and girls. Virginity tests are not scientific. Despite the deep cultural importance placed on virginity, there is no scientific or medical way to determine whether someone has had penetrative sex by examining the hymen. So-called virginity tests, including visual inspections, the infamous two-finger test, inserting fingers to assess vaginal tightness or hymen condition, or checking for bleeding after first intercourse, are unreliable and have been widely condemned. Here is why virginity tests fail. The hymen varies enormously from person to person in shape, size, thickness, and elasticity. Some people are born with very little hymen tissue or none at all. This is normal and healthy. Changes in hymen appearance can occur naturally due to factors such as elasticity and everyday experiences. Sports, tampon use, self-exploration, accidents, physical activity, and natural variation can stretch or alter hymenal tissue, and hymenal examinations do not reliably indicate sexual activity. There is no consistent or detectable physical marker that reliably correlates with sexual history. An intact-looking hymen can exist in sexually active individuals, and a stretched or absent hymen can exist in people who have never had sex. Virginity itself is not a medical or biological concept. It is a social, cultural, and religious construct with no corresponding physical state that can be verified. Major health organizations, including the World Health Organization, have declared virginity testing to be medically baseless, painful, humiliating, and a violation of human rights. It provides no valid information and often causes trauma to those subjected to it. By separating the anatomical reality of the hymen from the cultural meanings attached to virginity, we can begin to challenge the harmful beliefs and practices that rely on myths rather than facts. Peer-reviewed studies. While cultural and religious beliefs often link the hymen to virginity, decades of medical research consistently show that the hymen is not a reliable indicator of sexual history. Now, we will see a summary of key peer-reviewed studies and authoritative statements grouped thematically. These findings come from systematic reviews, clinical observations, and expert consensus in gynecology, adolescent medicine, forensic medicine, and public health. Studies showing the hymen is not a reliable indicator of virginity. Multiple studies demonstrate that hymen appearance varies widely and cannot accurately predict whether someone has had penetrative sex. Olson and Garcia Moreno, 2017. Published in Reproductive Health, this systematic review analyzed available evidence on virginity testing by hymen examination. The authors concluded that hymen inspection does not accurately or reliably predict virginity status. Included studies showed no consistent correlation between hymen morphology and prior sexual intercourse, and the practice can cause harm without providing useful information. Ms. Horry, 2019. Also, in Reproductive Health, this review dispelled common myths about the hymen role in determining sexual history or assault. The researchers examined published evidence on hymen morphology, function, and changes, concluding there is no evidence that examination of the hymen is an accurate or reliable test of a previous history of sexual activity, including sexual assault, except in a very specific circumstances. On the review, the researchers listed commonly encountered myths involving the hymen. Myth 1. The hymen is a membranous tissue that completely covers the vaginal orifice. Fact 1. A. The hymen is a membranous tissue that surrounds the vaginal orifice. Fact 1. B. The appearance of the hymen changes with age. Myth 2. The presence or absence of hymenal tissue can be used to determine if a girl or woman has ever had sexual intercourse. Fact 2. Changes to the hymenal tissue anatomy are not necessarily indicative of having had intercourse, consensual or non-consensual. Bleeding of the hymen. Missouri and Collagius noted that several studies documented that bleeding is not routinely observed after a woman's first sexual intercourse. Breaking of the hymen. The review further explains that in post-pubertal women, the hymen may stretch during penetration with minimal or no injury. Myth 3. Vaginal examination of the hymen can determine whether sexual assault, specifically non-consensual penetration, has occurred. Fact 3. Alterations of the hymenal appearance are non-specific and without corroboration with history and or other forms of evidence. No medical or legal conclusion may be inferred by hymen examination alone. Myth 4. Clinicians are well trained to identify the morphology and physiology of the hymen and to draw conclusions based on their inspection and examination. Fact 4. Clinicians receive little training in or exposure to the assessment of the hymen morphology. They emphasized that the hymen often shows no significant injury even after penetration due to its elasticity and variability. Adams, 2004. Published in Archives of Pediatrics and Adolescent Medicine, now JAMA Pediatrics. This study compared hymen morphology in adolescent girls with and without a history of consensual penile vaginal intercourse. Researchers found that many sexually active girls had intact or minimally altered hymens. Example, no notches or clefts visible in some cases, while non-sexually active girls showed natural variations. This highlighted that hymen changes are not consistently linked to sexual activity. Hippenstall-Hager, 2003. In clinical research examining adolescent girls with confirmed histories of sexual intercourse, Hippenstall-Hager and Collagius found that many participants still had normal-appearing hymens or only minimal physical findings upon examination. The study demonstrated that hymenal appearance varies greatly and that even sexually active adolescents may show little or no definitive anatomical evidence of prior intercourse. These findings further support the conclusion that hymenal examination cannot reliably determine sexual history or virginity. Zaid, 2022. Published in Archives of Sexual Behavior, this paper, co-authored by Egyptian forensic experts, evaluates virginity testing practices in countries including Egypt. It concludes that questioned virginity has no definite replay from hymen examination because of the great range of natural variations and non-sexual influences. The authors stress that medical and legal reliance on the hymen for proving virginity is unsupported and potentially harmful. Clinical guidance in a peer-reviewed journal, hymen exam cannot tell if intercourse occurred. Crosby, 2020, conducted a clinical review and guidance paper published in BMJ Global Health, examining existing medical literature, ethical considerations, and physician practices related to virginity testing. Their work focused on how clinicians respond to requests for hymenal examinations and the scientific validity of such practices. The authors concluded that examination of the hymen cannot accurately or reliably determine whether a woman has had sexual intercourse. They further emphasized that virginity testing is not grounded in medical science but is instead a culturally driven practice, and they recommended that clinicians avoid performing such tests and instead provide education and counseling. Pediatric or adolescent medicine, no scientific reliable way to determine virginity on exam. Mosawi 2022 published a review in the Journal of Pediatrics and Child Health focusing on hymenal anatomy and common misconceptions in pediatric and adolescent populations. Drawing on clinical evidence and gynecological research, the study analyzed the variability of the hymen and its response to different physical and non-sexual factors. The authors concluded that the hymen is not a reliable marker of sexual activity or purity, as its appearance varies widely among individuals and can change due to normal activities unrelated to intercourse. They emphasized that there is no scientifically valid or reliable medical examination that can determine virginity. Reviews and statements debunking myths and calling for an end to virginity testing. Global health bodies have reviewed the evidence and condemned virginity testing as unscientific and harmful. World Health Organization Interagency Statement 2018 under the title Eliminating Virginity Testing, issued by the World Health Organization along with United Nations Human Rights, UN Women, and other agencies. This document states that virginity testing has no scientific merit or clinical indication. It explains the appearance of a hymen is not a reliable indication of intercourse, and there is no known examination that can prove a history of vaginal intercourse. The statement calls for the practice's elimination, labeling it a violation of human rights that causes physical and psychological harm. Independent Forensic Expert Group IFEG Statement 2015. In a statement published in the Journal of Forensic and Legal Medicine, the Independent Forensic Expert Group IFEG reviewed the medical and scientific evidence surrounding virginity examinations and concluded that so-called virginity testing has no scientific or medical validity. The group stated that hymenal examinations cannot reliably determine whether a person has previously engaged in sexual intercourse and warned that such practices may amount to degrading, inhuman, or even torture treatment. The statement concluded that forcibly conducted virginity examinations are medically unreliable, have no clinical or scientific value, and can cause significant physical and psychological suffering. Rogers and Stark, 1998. In a letter to British Medical Journal, these forensic medicine experts addressed myths about the hymen, stating the hymen is not necessarily torn after sexual intercourse. They noted that education about hymen variability is urgently needed, as many hymens remain intact or show no tearing post-intercourse due to elasticity. Physicians for Human Rights, 2015. This forensic brief reviewed multiple studies across countries and concluded there is no factual, scientific or medical basis for using hymen size, morphology or integrity to determine whether a woman has experienced vaginal penetration and therefore the state of her virginity. The brief further states that evaluations to examine the hymen are often undertaken without consent and can be psychologically and physically harmful to women and girls, making such examinations medically unnecessary and unethical for health professionals to perform. American College of Obstetricians and Gynecologists, ACOG, the American College of Obstetricians and Gynecologists, one of the leading professional organizations in women's health and gynecology, states that virginity testing is not a medically indicated or valid procedure and that physical examinations purported to assess virginity are without basis. ACOG further notes that the practice raises important ethical concerns and has been associated with adverse psychosocial and physical outcomes. Royal College of Obstetricians and Gynecologists RCOG. The Royal College of Obstetricians and Gynecologists in the United Kingdom has similarly opposed virginity testing and misconceptions surrounding the hymen. RCOG has similarly opposed virginity testing and states that there is no known medical examination capable of proving whether a woman has had vaginal intercourse. RCOG explains that the appearance of a hymen is not a reliable indication of intercourse and notes that harmful myths surrounding virginity can contribute to stigma, pressure, and harmful social expectations affecting women and girls. Emmons, 1994, conducted a prospective clinical study involving 300 post-menarcheal adolescents to examine the relationship between hymenal anatomy, tampon use, gynecologic examinations, and self-reported consensual sexual activity. Participants were divided into 3 groups. 1. Adolescents who reported no sexual intercourse and used pads only. 2. Adolescents who reported no sexual intercourse but had used tampons. And 3. Adolescents who reported a history of consensual sexual intercourse. The researchers examined whether specific hymenal findings were associated with tampon use or sexual activity, and whether physical examination findings could distinguish between these groups. Their results showed considerable variation in hymenal appearance among individuals. Complete clefts in the lower hymen were observed significantly more often among participants who reported consensual sexual intercourse than among those who reported no sexual activity, while tampon users were not significantly different from pad users with respect to this finding. The study also reported wide ranges in hymenal opening measurements across all groups. Overall, the findings demonstrated substantial variation in hymenal anatomy and indicated that hymenal examination findings alone were not reliable indicators of prior sexual activity. These findings challenge the common belief that a medical examination of the hymen can definitely determine whether a person has had sexual intercourse. Evidence on hymenal elasticity and anatomical variation. Research demonstrates substantial variation in hymenal anatomy and elasticity among individuals. Kotib 2022. This Egyptian forensic comparative study, published in the International Journal of Health Sciences, examined 303 recently married women in the first week after their wedding. 189 complaining of bleeding on the first intercourse, 114 of severe bleeding. Results showed that 82.5% of the bleeding group had an annular elastic hymen, no tearing or injury, while only 15.8% of the severe bleeding group had a deflorated torn hymen. The rest remained elastic and intact. The authors concluded that post-pubertal hymens are frequently elastic in the Egyptian population, so an intact hymen does not prove virginity, and the absence of injury cannot rule out prior penetration. This forensic evidence directly shows how elasticity and non-sexual factors make traditional proof of virginity impossible. Makan, 2007. In a clinical study examining the healing of hymenal injuries in pre-pubertal and adolescent girls, Makan and colleagues found that hymenal tissue often heals rapidly and in many cases may heal completely without leaving obvious or permanent signs of prior injury. The researchers observed that many hymenal injuries healed rapidly and often left little or no detectable residual evidence over time, particularly when injuries were not extensive. These findings suggest that the absence of hymenal findings cannot reliably be used to determine whether prior vaginal penetration occurred, because many injuries heal without leaving permanent visible evidence. These studies collectively affirm that virginity is a social construct, not a verifiable biological state. The hymen's natural diversity means it cannot serve as a proof of chastity. Major medical organizations urge ending virginity testing and related measures to prevent harm and promote evidence-based understanding of bodies. Why the myth persists despite science? Despite decades of medical research showing that virginity cannot be verified through examination of the hymen, these beliefs continue to persist in many societies around the world. One reason is that virginity has historically been tied to systems of family honor, inheritance, and control of women's sexuality. In many traditional cultures, ensuring a woman's premarital chastity was connected to concerns about lineage, paternity certainty, marriage arrangements, and social reputation. Over generations, these ideas became deeply embedded with cultural and religious traditions, often reinforced through social pressure, community expectation, and misinformation passed down within families. As a result, scientific evidence alone does not always immediately change long-standing beliefs. Misconceptions surrounding the hymen and virginity continue not because they are medically accurate, but because they remain socially and culturally powerful in many communities.